Hello, I am Dr. S.K. Gautam. Presently, I am working as a professor of medicine at GSBM Medical College, Kanpur. So, here in the BPCON 2022, I have presented the topic Accord BP trial. Although the trial was not new, it was around 20 years back it was done, but that was because of done to just see the cardiovascular outcome when we lower the systolic blood pressure from 140 systolic to 120. So, in this trial around more than 4,000 patients were enrolled and they were randomized, and the main result came for this trial was that they have made the two group basically. One is an intensive group, second is a standard group. And intensive group, they have enrolled the patient in which the systolic target is of the systolic blood pressure is less than 120, and then in standard group the target of the systolic blood pressure is less than 140. So, when result found, the total population was around in which the 48% were the females, and the average age was around 68 years, and the average HbA1c is around 8.7. So, the results came for the outcome, cardiovascular outcomes are not as much as good as in the if we go beyond the 120 systolic blood pressure, because there are a lot of factors were there. They have not included the 130 systolic blood pressure. They have not compared because they have made the two group only. One is 140 less than 140 and second is 120. The outcome came the 120, the intensive group is not having a much superior as compared to the 140 systolic group, because the cardiovascular outcome are, even the cardiovascular deaths are more seen in the intensive group as compared to the one thing we can say in the stroke incidence of stroke were less in one intensive group as compared to the standard group. So, the conclusion of the study, the intensive group, that is the systolic blood pressure less than 120, is not superior to the systolic blood pressure less than 120. In fact, when we reduce the pressure to less than 120, there is a lot of side effects were there in form of hypertension, hypokalemia, EGFR going down. So, a lot of side effects were there for when we go below 120 systolic blood pressure. Although the limitations were there, because the trial was not included the age of less than 40 years and more than 79 years, and second limitation was there, the time period was also less. It is the study was less than 5 years. So, around 4.7 years it was conducted. So, this time is not very much to evaluate the cardiovascular outcomes in the when the patient is on tight control and having the hypolipidemic drugs and having the statins also. And the third point is they have not included a group, they have not commented the below 130 systolic blood pressure, as the GNC 7 says 130 is the target, but GNC 7 came although the trial was started first. So, these are the limitations in the study. Thank you so much.